This part of the lecture is looking at nurses changing healthcare. So we know nurses can improve health services in a cost-effective way from merely being at the bedside and understanding how organizations work and how the healthcare system works. We talked in our last Zoom class about the importance of nurses being encouraged to practice outside of their scope of practice and take on more leadership roles. And this can be achieved by looking at entrepreneurship and intrapreneurship roles. And so that's what we're going to look at right now for the next few slides. So what is entrepreneurship? Well, it's a process of uncovering and delivering an opportunity or developing an opportunity to create value through innovation and seizing the opportunity. It's as a nurse, you see something and you're like, hey, I can do that differently or better. So it's all about pursuing maybe a personal vision and a passion to improve health outcomes using innovative approaches. Oftentimes, it's an individual who's self-employed, you work independently and are directly accountable to the client for whom they provide services. And it may be an individual who develops a new idea, improves delivery methods, and develops new products. So that's just an overall definition of entrepreneurship. So what are the advantages and disadvantages? Well, the advantages is that you are your own boss, you're independent. Your income increases, you have a chance to be creative, innovative, and be original. There's lots of possibilities, and there's a good salary potential. The disadvantages is that there is an idea or a feeling of money pressure because there's no security of a paycheck, and that can be daunting in the midst of COVID. You don't have benefits, there may be long working hours, and really your decisions are made alone and not in a group. So let's talk a little bit about something called social entrepreneurship. So most entrepreneurship enterprises are commonly viewed as business ventures intended to achieve financial gain within nursing or within a profession. And it can also be seen as seeking to achieve good health outcomes for most number of people. And that's what social entrepreneurship is about. So it's an approach that involves the design and implementation of innovative ideas and practical models for achieving a social good. So it focuses on creating social returns. So you may notice a need and develop a way of remedying that issue. Maybe you notice something in your practice setting. And a leader and change agent who recognizes what isn't working and maybe, figures out something that can be more practical, innovative, and sustainable as an approach to generate solutions. And so what it is basically an approach that involves the design and implementation of innovative ideas and practical models for achieving a social good. So making new ideas stick in entrepreneurship. Well, social currency is one. Determine how it makes people look. Is it innovative, creative, to talk about the product idea? So you've got to get it out there. So social media. Triggers. Create reminders for people to talk about the product or ideas. Emotions. Using emotional content that people care about. Public. Keep the idea visible. Practical value. Present the information so it is easy to pass along to others. Stories. This is what Instagram is based on, the stories. Embed the product or idea in a story for people to share and create an innovative, fun working environment to stimulate positive, sustainable changes. So it's all about the organizational culture if you've got more than just one individual working with you. So that's entrepreneurship. What about intrapreneurship? So intrapreneurship is a salaried employee. So you're working within, say, a hospital setting. So it's often within healthcare organizations who develops, promotes, and delivers an innovative health or nursing service within a healthcare setting, such as a hospital or nurse-led clinic. So this is an individual who develops innovative health practices from within the organizational framework in which they work and share the risks and benefits associated with the innovative practice with the employer. So what are the advantages and the disadvantages? The advantages is the ability to stay in a well-known environment, lower risk staying lower risk by staying within an organization. You using the organization's name, resources, and knowledge, and you have access to customers and infrastructure. The disadvantages is that the reward may not end up to your expectation. You may not be appreciated for the innovation or hard work. You're not your own boss, and you may be limited by the structure and policies of the organization. So what are the similarities and differences between entrepreneurship and intrapreneurship? Well, the similarities is it involves an opportunity to recognize that something new needs to be developed. It's a unique business concept, a product, process, or service. It's kind of a balancing of a vision between being a manager, you're passionate, you're proactive, but you also need to have patience. Ideas require adaptation over time. You need to watch for that window of opportunity, and it does require some risks. The difference is that in startup entrepreneurial, it takes risk. Organizations take risk in the intrapreneur activities. So, you're taking the risk in entrepreneurial, and the organization is taking the risk if you're doing it within the organization. The entrepreneur owns the concept and business, while ideas and concepts are the intellectual property of the organization rather than the intrapreneur. The entrepreneur, one strategic bad decision can mean instant failure, whereas in the hospital setting or organization setting, you have the support of the organization. And the last one is the entrepreneur is susceptible to challenges and barriers outside the environment, whereas the intrapreneur has the buffer of the organization. Now, they both need certain things. They both need an individual with an advanced knowledge level and skills. They both need someone who's self-confident, that has the courage and integrity and the self-discipline to, think of an innovation and drive it forward. And you need to have the ability to take risks, deal with failure, and are good at articulating your goals. The barriers to self-employment are lack of recognition, lack of a safety net, which is really important, and adversity that goes along with being an entrepreneur. So aside from being an individual and thinking of these innovative ideas through entrepreneurship or intrapreneurship, I want to talk a little bit about intraprofessional and interprofessional, because looking at our different roles within the healthcare system is going to need a team in most cases to move forward. So I know you've discussed this before in other classes, so I'm not going to go into a lot of detail, but intra-professional collaboration is multiple members of the same profession, so nurses, working collaboratively to deliver quality care across the settings. So it could be nurses, it could be RPNs, RN, nurse practitioners, all working together within the same profession. And interprofessional is that partnership between a team of healthcare providers, and as well as the client being in a participatory role, and you collaborate and you coordinate approach to share decision making around a health or social issue. So intra and interprofessional care. I want you to think of an example where you worked in an inter and an intra-professional team. And I want you to think about who was involved in the team, what were the differences, what worked well, what didn't, and what surprised you about working in a team like this. And the Canadian Nurses Association have identified certain characteristics that facilitate collaboration among professionals and among professions and among professionals. And so they say that interprofessional collaboration, you need these for effective collaboration. The first one on the left is client-centered care. So you need that collaboration between the client, and the client has to be that interprofessional part of the care. So the client is at the center. And also they need to be involved in the collaboration with the nurses and other healthcare professionals. And so they all work together as a team, and they work at the individual, organization, and healthcare systems level. evidence-informed decision-making for quality care. And so the evidence-informed decision-making is done through the use of best practice guidelines, protocols, and resources that support the interprofessional collaboration. And so healthcare professionals work together to identify and assess research evidence as a basis for identifying treatment and management of health problems. Access. So teams of healthcare professionals work in collaboration will ensure that patients have access to the most appropriate healthcare provider at the right time and at the right place, and that supports the continuity of care. Epidemiology is using assessments of the demographics and the health status of clients, which will ensure the relevance of health services, including identifying the appropriate health professional. And it's also important to understand the trends in the healthcare system and that the trends in the health of populations are tracked to access the impact of the services offered. So if there's a spike in diabetes, epidemiology will look at this as an indication that maybe we need more nurse individuals or nurse educators with respect to diabetes. Social justice and equity. Canadians are entitled to a health system that has the capacity to keep people well by linking interprofessional collaboration care to social justice, equity, and determinants of health. And then ethics is all about, it brings its own set of competencies, your ethical competencies, and that in interprofessional collaboration, you learn from each other's in ways that can enhance the effectiveness of the collaboration of your duties. So you're really all coming from the same ethical point of view. So effective collaboration is very, very important. And if you have effective collaboration, 80% of the errors that happen in healthcare settings due to miscommunication will not happen if you have that effective collaboration. And so it's all about sharing, respecting, having that partnership, trusting, the interdependency, assertiveness and communication through active listening and effective communication skills is really important for effective collaboration. So this is from the National Interprofessional Competency Framework, and it looks at how you can work well with others. And the goal is interprofessional collaboration, and it looks at the goals. So right in the center, you have the importance of role clarity. What is everyone doing in the group? The importance of conflict resolution, the importance of leadership, the importance of having a good team functioning. And that is all going to look, the broader parts of that are looking at, the situations and the issues that you're looking at. What are the contextual issues? Is it a quality improvement? Is it a simple or complex? And so in the center of all this is the interprofessional collaboration and the importance of the patient, client, family, community-centered care, which is around the outside, and the importance of interprofessional communication. So just a great framework that can be used by everyone. So what does the nurse bring and need to know within the team? Well, the nurse brings the holistic understanding of the person's needs. You're at the bedside and you have an idea of the person from many different angles, from a physical point, from an emotional point, from a social point. You have a unique body of knowledge. You can clearly articulate the key role that you bring to the collaborative team. You advocate for the person, you demonstrate and articulate the nurse's role, knowledge, and skills with confidence, and you can speak in a language that other people understand. And it's important to be assertive, and you can't be silent. So as you move forward in the rest of this module, I want you to think about embracing the future of nursing, and I'm asking you to review the readings and the videos and then go to the activity of the week.